Hi, I'm Dr. Janae Brown, physical therapist in San Pedro, California, and today I'd like to go over my 4 favorite exercises to reduce shoulder pain. These exercises are great for any shoulder injury. So the 4 exercises I'm going to go over are bilateral shoulder external rotation, bilateral horizontal abduction, rows, and shoulder internal rotation. The first one we're going to do is going to be bilateral shoulder external rotation. I'm going to use a Theraband. This is a red Theraband, which is about a medium resistance Theraband. And you're just going to place it in your hands, elbows at your sides, palms up, and you're going to just grip the band. And you're going to just pull the band slowly apart like this and back together. It's really important that when you pull out that you do it slowly and that you don't let the band snap back and you control the return. The return is probably the most important. So you're going to do that repetitively. I recommend typically 2 sets of 10 to begin with and to go up to 3 sets of 10. In the front, it's going to look like this, and you're mostly going to feel it in the top of your shoulder in this area right here. We're working on strengthening the rotator cuff. From the back, the exercise looks like this. Squeezing those shoulder blades together and coming back to center. Squeeze and back to center. So that's my first favorite exercise. The second exercise I'm going to go over is bilateral shoulder horizontal abduction. You're going to place your arms out in front of you, shoulder width apart. Again, tension on the band should just be about shoulder width apart, straight in front of you. You're going to pull the band slowly apart and back together. Pull the band slowly apart, back together. You want to keep your elbows straight and locked. If it feels pretty easy to do that, you're going to grab more band together. If it's hard to do, you're going to take less band. Also, if you want to get wider and go further, you want less band, and that'll let you go a little bit wider and get more to a T position. But the goal is that you're pulling the band apart and you're filling it in the middle of your shoulder blades and the back of your shoulder. Okay? From the back, this exercise looks like this. Squeeze and pull and slowly return. Squeeze and pull and slowly return. The third exercise I'm going to show you is rows. For rows, you want to have a door near you. You're going to take your band and you're going to tie it around the doorknob. Make sure it's just sort of separated and tied evenly so you have an even amount of band on each end. You're going to hold the band in your hands like so, and you're going to pull and squeeze back like this. So you're just going to release nice and slowly, and you're just keeping your elbows at your side, and you're pulling nice and slowly, and you're squeezing your shoulder blades here in the back. So from the back, this is what it looks like. Squeeze and hold and release. Again, with that exercise, I would say 2 sets of 10 to start off with. Between each 10, give yourself about a 15 to 30 second break. And the last exercise that I love to have my patients do that have shoulder injury or pain is internal rotation. You can leave the bands just like this, or they're already tied. You're going to take one side of the band. Arm is going to be at your side, elbows bent at a 90-degree angle, and you're going to pull the band in and out. Sometimes I have my patients hold their shoulder right here just so they can feel the movement of the shoulder, and you're pulling in and out. Typically, you're going to feel this through the pecs here, the anterior part of the shoulder as you do this. The muscles that come around the rotator cuff sort of attach right there, and that's why you feel it there. Okay, and again, 2 sets of 10 for this exercise. I hope that you've enjoyed these exercises. If you'd like more information or you want to follow my social media pages or my website, you can click on the links below. Thanks for tuning in.